time, the chair will recognize Senator Francis Heyliger for her 5 minutes.
Good afternoon, colleagues. Good afternoon, testifiers. First of all, I don't know if I missed it, but I need for you to tell me locals that are living here versus the traveling nurses. Does anybody have any numbers from each of the hospitals?
Senator Heyliger, I don't have any of the hard numbers here with me, but I will share that outside of the Pafford staffing, we are largely locally hired. We don't have a large component of travel nurses here at JFL.
Okay, and Schneider Regional?
I will defer to my Executive Director of Human Resources, Ms. Walden Mason.
Hi, good afternoon. Ralda Mason, Executive Director of Human Resources. At Schneider, we have about 85 registered nurses on our roster as regular full-time nurses, or as an FTE count. And then we have approximately 10 agency nurses, and then we're supplemented with Pafford nurses who are supplemental for temporary as well.
Okay, thank you. I was listening here to the dialogue earlier in regards to the mandates put out by our health institutions. And I am a supporter of anyone that chooses to be vaccinated. I think if people have listened to what the public has said, what has been put out, and they have made the choice and decided that this is in their best interest to protect themselves, I think that's 100% to go. I literally came off the phone with my own sibling who had COVID, and she called to tell me that she was at CVS taking her first shot. And I said, congratulations. If you have read all the data and you think this is in your best interest, your sister, who is mother and father, grew up with her, will support you. But I also have to realize that a representative of all of the people of the Virgin Islands, I have to also be mindful that there are some in our community that opt not to be vaccinated. And I think we should not be in a situation where their liberties are being trampled on in a way it almost seems that things are being said and done to take away their ability to choose. And that is a concern for me. I have taken the time out and spoke to many of the nurses, and I've even participated in some of the protests. And if these are the same individuals and doctors and nurses and people that went through the pandemic, did what they needed to do to protect themselves, to assist many people, why do we not trust their judgment to say, guess what? I would also like to have an option to say test weekly. Is there a reason why the option for testing weekly has not been offered to the nurses, as opposed to just saying you either get vaccinated or you get fired? Because for me as a representative of both the vaccinated and the unvaccinated, that scares me. Because I don't want our people to be in a situation where you're telling them, if you do not let me stick a needle and put something into your body, you cannot feed yourself. If you do not let me put a needle and put something into your body, I will take away the ability to take care of your children. If you do not allow me to put a needle in your body and put this vaccine in your body, I will take away your ability to put a roof over your head. I don't like that narrative, and that is where my concern comes in. I understand what is happening in our community with this pandemic. I do what I have to do, whether it's wearing masks, washing hands, moving, I do it. And a lot of people in our community do it. But as much as those that are vaccinated can also contract COVID and also spread it, I think unfortunately there's a false narrative from my perspective that is being put out there that once you are vaccinated, that all is okay. That's not the case. We still have to do the things necessary to protect ourselves. One of the things that I felt the CDC did, in my opinion, that was not good, is when these vaccines came out initially, take off your mask. Everybody just, we could do whatever. But what I have noticed is every time a mandate has been put out, some information has been put out temporarily at the time, it gets changed. I remember when this pandemic first started and we didn't know what was happening. It was everybody don't wear masks because we need to leave the mask for the healthcare workers. Then it was everybody wears a mask. Then it's the vaccine. Everybody who wears got the vaccine. We don't need to wear masks. It's too much information because we are learning as we go along. And I don't want to be stuck in a situation where we're so gung-ho at this moment on vaccinating and nothing else, that 6 months from now, it's a totally different narrative that's being put out to the public. I am 100% in support of those who have been vaccinated. But I represent the entire Virgin Islands, and I cannot ignore the voices of those that have said, listen, I want an opportunity to wait to see when the FDA has decided to approve this, then I'll take the vaccine. I cannot ignore the voices of those that say, I have theories. I cannot ignore the voices of those that say, you know what? I have read a lot about this, and at this moment, I do not wish to do it. I'm not saying I'm not going to take it later on. So I'm asking you, the same way that this institution, they have mandated it as well for the employees, but they gave them a choice to take tests weekly. The government has done the same thing under the executive branch. The federal government has done the same thing. So I'm asking you, explain to me, when the same nurses that battled this pandemic and help us get through it, how do you take away their choice to decide whether they want to take it or not, or they cannot feed themselves? That is my concern. Thank you.
Thank you very much, Senator Francis Heyliger.
When there's something
Commissioner,
that needs to be said after the senator spoke. So when I can, please allow me to.
Commissioner, you could go at this time, and then we'll come back to Senator Gittens. You may proceed.
Thank you. I appreciate that. In terms of false information in reference to the vaccine, I think it's important to note that vaccines actually do save lives. It's proven throughout the world that vaccines actually do save lives. We spoke a lot about vaccinations and viruses and the way viruses actually replicate. And I do not have Dr. Ellis or Dr. Hunt on the call today. However, viruses actually replicate and duplicate. That's where you have the variants. And that occurs when you do not have the immunity level around you to prevent that duplication or the variants actually being replicated. So because of that reason is why it's so critical for us. The Delta variant would not have been around had we had throughout the world. It's not just the VI or the nation, but throughout the world, had we had the number of immunity or high level of immunity that's needed to suppress that transition of the virus from one person to the next, as well as the mutation takes place within the body. So that's really what the intention is. That this is a pandemic. This is not just the annual flu that we're talking about. And yes, people's rights and really has to be heard of. But one of the things also, patients also have the right of being safe in a hospital environment. And there have been some exposures, not just here within a territory, but nationally and worldwide, in which some individuals have been admitted and contracted COVID-19 from a healthcare provider. And so that's one of the reasons why we're the board, I can't speak with Chairman Finch, he's not here, but I am a member of the board, and that's one of the reasons why the board is acting in the way that we are acting at this point in time to not just support the territory, but support the patients as well as the staff within the hospitals. But vaccines have proven to save lives, and I agree, it's not just the vaccine, the masking, the social distancing, and the hand sanitizers and hand washing. It's the whole gamut that actually produces that. But the vaccine reduces transmission and allows you to live a healthy, a safer life without high incidence of illness or death. Thank you for the opportunity, Senator.
One second, Senator Francis Heyliger, you had a comment? A point?
Yes. I wanted to do a point of inquiry at this point. I had asked a specific question that wasn't answered when I had stopped speaking. I asked the question, is there a reason why, like other governments, to include even us here in the first branch and the second branch, is there a reason why weekly testing was not an option for the employees at the hospitals? Thank you.
Thank you. That will go to ICO Williams and Dr. O'Mara.
Good afternoon, and thank you for that question. We are currently, meeting with the board and looking at all options. We certainly, I have to echo what Commissioner Encarnacion said. The goal is to prevent transmission. As healthcare workers, just as, if you read my recent article in the Daily News, when you enter certain fields with a certain level of responsibility, you're going to enter that field to carry on the mission and duties of whatever that responsibility is. As healthcare workers, and as a physician, our first motto is first do no harm. In so being, the first goal is at the highest level, what is the best and latest model for preventing transmission of this pandemic, of this disease? As the data shows, that best level as an additional tool to the other things that are being done, including masking, social distancing, hand washing, and all infectious control measures, that now additional tool has become by very clear evidence, vaccination. Now, if you are unable to vaccinate for reasons that are stated within the policies that are currently under development and have been handed out, then we are looking at what is the next best thing to prevent transmission. Weekly testing would be an additional tool. It would be an addendum type of tool that we can look at to prevent transmission. However, let it be known that you can test weekly. If you test on a Tuesday and catch the virus on a Thursday, you are now going for an additional 3, 4, or 5 days of transmitting that disease to another individual before you test again. And even testing that next week may not reveal a positive result because it may still be too early. And you may go an additional week of transmitting that disease to patients in the hospital who came in COVID negative and are expected to leave the hospital in a better state, and you have now posed a potential of making their health status worse by transmission of that virus because your test has not yet become positive. These things are looked at very carefully. We've never done a mandate before of this proportion, but we've never had a pandemic of this proportion. And so those individuals who come in for treatment have a right to be treated and have a right to not contract the virus when they did every measure possible at home to prevent contracting the virus. And now because they had an unrelated viral illness, they had an unrelated illness not related to the virus, and they came in and now they contract the virus in the hospital from a hospital worker who did not vaccinate. That becomes something very difficult to defend against. And so from that perspective, we may look at weekly testing and put that in, but it is certainly not the best practice of medicine by the standards of what is looked at as clear evidence.
Best practices, just quick question, I'm asking this question. Best practices as a hospital. If you're saying that the unvaccinated weekly testing could potentially drag on a potential COVID outbreak, the question would be, well, then would it not be best to test everyone? Because it's already been proven that those that are vaccinated can also have COVID and be spreading it throughout the hospital. But I thank you for your answer, and I hope the board does look into it. The other young lady, I'll take her answer, and thank you for the additional time.
Thank you, Senator Francis Heyliger.
If I may, this is ICO Williams, and so I would echo the sentiments of Dr. Amaro and Commissioner Encarnacion. I think within the healthcare arena, the rules of engagement are distinctively different. I will share with you, as a registered nurse myself, I could not even enter nursing school without mandatory vaccines. And it is long been a standing provision of healthcare providers to be vaccinated so that we are not inadvertently exposing our vulnerable patients that come to us with other healthcare issues and inadvertently exposing them to illness that they did not present with. And so vaccines, quite frankly, have been a hallmark of healthcare since the beginning of time. And as we continue to evolve through the pandemic response, yes, there has been implementations that have been instituted that has also evolved. And that's what we're doing in terms of being top of mind and as agile and responsive as we need to be to the rise in our community. We've now, for the first time, gone above our 5% mark, which is, again, a red flag for us, as is the hospitalizations on both islands. That is another hallmark that we're looking at in terms of our holistic response as a territory. And so as we look at our markers and what tools in essence are available to us in terms of curtailing the spread of this pandemic, mandatory vaccinations is one of the tools that we've instituted in terms of, PPEs and social distancing and masking. 100% of that is applicable in the healthcare arena, as is vaccination, as we've historically done. And I will share too that the Delta variant is one of those additional considerations to be most effective in terms of testing, specific to your testing question. To be most effective, you would essentially have to test every other day. And look at the resources that you would need to have readily on hand to test your clinical staff every other day as well, which is in itself is not necessarily sustainable.
Thank you, CEO Williams.